Could you tell me a little bit about the benefits and detriments of people who try to expose their skin to more light in EPP?
So that is quite an interesting question, actually. It is definitely true. We obviously use ultraviolet light treatment, and it does toughen up the skin. And there's this effect. It makes the skin a little bit thicker. It makes the skin a little bit more tanned, and all those things stop a little bit of the light getting down to the blood vessels in the skin, which is where the damage and the pain happens. Many people do find that they get a bit better, particularly the people with the sort of milder end of the level of EPP, that it gets a bit better towards the end of the summer for the same reason, really, that August is easier than May, quite often. And then we get into the thing, well, how much should one expose oneself? And that partly depends on how much you know your limits and how severe your EPP is. If your EPP is very severe and you've got 5 or 10 minutes before you end up with an attack, you've got very, very little room for error. And of course, if you get it wrong, you've got the misery of an attack. So it's a difficult thing to do.
Yeah.
And also you obviously can't tolerate quite so much toughening, so not so much hardening can happen because there's less light you can take. If you've got milder EPP, which takes longer, then you may know very well what your limits are and go within those limits. If you go within those limits and manage to sort of toughen the skin up a bit and not provoke the attacks, well, that's great. The problem always with EPP and trying to sort of improve things by toughening the skin up in the sun is that there's always that thing of having the experience to know that you're not going to make a mistake. And I think that comes to people as they get older, but even the most experienced people, they can sometimes get caught out by certain conditions, a windy day which is very sunny where you don't feel the sun on your skin or something like that. And sometimes people, and of course the price for getting it wrong is very high in EPP because it's 3 or 4 days of real misery. So people develop it for themselves. Some people have tried sunbeds for the same reason. Sunbeds, in theory, should not set off an attack of EPP because they're ultraviolet A, and it's visible light that causes, which is different, causes the pain in EPP. The problem is they're very close to each other. So you're relying on the fact that the sunbed is set up in such a way that it doesn't contain any of those visible rays. And that may often be the case, but you've got no guarantee. And if it did, you'd have a very, very painful experience. I mean, clearly, in a general sense, we're not, dermatologists don't recommend going on sunbeds anywhere, a lot of sunbed exposure, because a lot of sunbed exposure increases, skin cancer risks. But I guess that in EPP, the main risk in a way would be that you've got a wrongly tuned sunbed and it just might set you off. I've never heard of it happening, but one always sort of thinks that the only reason I say it is because the wavelength of light that causes the EPP pain is quite close to the wavelength that causes that is used for tanning in a sunbed. So the answer is a lot of people do it, and I suspect a lot of you do it, and it can be helpful, and we use it for ultraviolet light treatment ourselves, but it's worth thinking about, but not maybe being slightly cautious about it as well for those reasons.